And welcome back. And we're moving into our first conversation for today, finding out about a survey that we'll be rolling out this month, looking at risk factors for chronic kidney disease. And with us, we have a panel of the different entities involved. We have Dr. Francis Morey from the Ministry of Health. He is the Deputy Director of Health Services. We have with us Jacqueline Montique Small, who is a demographer for Census Surveys and Administrative at the Statistical Institute of Belize. And we have John Lin, who's the Project Manager through Taiwan ICDF. Good morning and welcome.
Good morning.
And thank you for being here.
Thank you for having us once again on your famous show.
You know, it's always it's definitely good to have you in. The energy is beautiful, and that's one of the things that we always gravitate to. Now, let's get into it, though. Chronic kidney disease. Here in Belize, we hear a lot about it, but people don't really pay much attention. Reason being is because probably one of the things that have always taken the scene is actually about sexual transmitted diseases, so people would focus more on that, when in reality there are things that eventually take us down as well. So talk to us firstly about kidney disease.
Okay, thank you once again for having us on your show. As you rightfully mentioned, kidney disease, it's not that it's a disease that society on whole may be quite aware of it. But over the past few years, Belize has been our population has been affected by an increasing number of individuals who have been suffering from this disease. And so one of the biggest issues is that we have a high rate of individuals who have diabetes, who have high blood pressure, which are the main diseases that can eventually lead to this a person suffering from it. If you don't have your diabetes under control, if you don't have your pressure under control, if you have, for example, polycystic kidney diseases, which is another entity that could lead to that, and a few other diseases that can eventually give you chronic renal failure, we have, as a society, begun to suffer the consequences of individuals not living a healthy lifestyle, not controlling these two major diseases that our public or our populations are highly affected by. So chronic kidney disease is as a consequence of uncontrolled these two essential diseases that are not controlled. And so by itself, we really don't have a true picture of how many individuals in our country are being affected by it. We may have the statistics that we have. We need to actually develop a profile, have a good description of who, where, when, and why these people are suffering from chronic renal failure. The issue being that, for example, we partnered with Taiwan a few years ago. We've had work coming into the country doing training for nurses or dialysis, as we already have dialysis in country, being in the public sector, being sponsored by or subsidized by government, and also we have a private entity in the north that's doing dialysis for our patients and the general public who are affected by this. But so it's at this point in time, the awareness is there. We have essential persons from the public who have been affected, and so the noise has been a bit much more forthcoming in our society, especially by families of individuals who are affected by this. And so we partnered with Taiwan, and with a 3-year project for the chronic kidney disease in Belize, and it has this began last year in February, mid-February, and it's for a 3-year period.
Yeah. Now, that's a great way to bring John into the conversation to talk about this particular partnership. You're obviously moving beyond just providing technical expertise in terms of the dialysis units, but now moving into understanding more so the contributing factors. What will be the involvement of the Taiwan ICDF in the project, and what do you hope to be able to achieve?
Okay, this project actually is divided to sections. One is for prevention, the other one is for control. So as you know, for the prevention part, actually we have this kind of community survey. Because as Dr. Morey mentioned about chronic kidney disease, the hypertension, higher blood pressure is the main causes of chronic kidney disease. And we would like to have a community survey through the SIV support and to perform this survey to identify what's the risk factor of chronic kidney disease in Belize. Because right now, we try to identify the early stage of chronic kidney disease. Because in the early stage of chronic disease, sometimes there's no syndrome. It means if you have this kind of disease, it means you have no syndrome. You can eat, you can walk, you can exercise, you can do everything. But there is no syndrome, so it means that this kind of patients, they are now aware what's the problem of them. So that's why we do this survey. And do this survey, in the final, we will have a database of this group. So we will find out who will be the potential patient in the community. And we encourage them to go to public medical facility to do a regular checkup, to care about their health. Because if they don't control well, the kidney function sometimes, always if it's getting worse if you are getting older. So it means if you don't care about earlier, it means the kidney function will reduce the functions. So after this survey, we will have a database and we try to establish a cohort. Cohort means we will get support from Ministry of Health to do the surveillance. It means this group we expect they can take care of their health, and we expect this community survey can produce a statistical report. After this report, we can provide some suggestion to Ministry of Health to further health policy. So this is for prevention part. The second part is for control part. Actually, we have some workshop for medical officers and for dialysis registered nurse. It means we not only do the prevention, it means we have some severe patients on chronic kidney failure. So it means if they continue to receive the hemodialysis treatment in their hospital, but we believe the medical quality service is quite important. So that's why we have this workshop for medical officers, for dialysis nurse, to improve their knowledge and skill and to renew what do they have the skill right now. So that's what we are doing this right now.
Now, the survey is aiming to test 10,000 people. That's what we know so far, right?
10,000 households.
10,000 households.
So ultimately, we're expecting to get about 20,000 persons.
Oh, okay. So you'll be testing everybody in the household. Now, that's very important because I wanted to find out. We know the general risk factors associated with chronic kidney disease. You pointed out some of them. If you have uncontrolled diabetes, if you have uncontrolled hypertension, lifestyles that you may particularly have, what will our survey provide us that will be unique to Belize, especially since the general risk factors are acknowledged across the globe?
Well, this is the first survey of its kind in our part of the world.
Yeah.
And the questions that we're asking will highlight, one, people's lifestyle, because as Dr. Morey mentioned, your lifestyle has a lot to do with whether or not you develop chronic kidney disease.
Yeah.
So we'll be asking about persons' educational attainment, because your education does have an impact on your lifestyle. We'll be asking about your diet. We'll be asking about what kind of exercise regime you're involved in. We'll be asking about your exposure to chemicals, and we'll be asking about the history of disease. Well, whether you have several chronic diseases, for example, hypertension or diabetes, and we'll be asking if your family, if anyone in your family has had the disease, because if anyone in your family has had it, then your likelihood of getting it increases. So we'll be going to households and we'll be doing a very short household survey, which basically tries to find out the number of persons in the household and their educational attainment. Will be focusing on persons 20 to 55 years. So it is for persons 20 to 55 years that we'll be asking all these other questions. And in addition to the questions that we'll be asking them, we will have a trained nurse from the Ministry of Health who will be taking their temperature, their height, weight, waistline, blood pressure, blood sugar, And we'll also have a phlebotomist with the team who will take a small blood sample, and that will go to the lab and will perform tests for cholesterol, bone, urea, creatinine, and together all of this information, the findings from the lab test, the nurse's measurements, as well as the responses to the questions, when we put that together, we will be able to see, one, whether, well, what number of persons have chronic kidney disease, and what number of persons are likely to develop chronic kidney disease based on all that we're seeing. As well as we'll be able to look at the different factors, the different characteristics of both sets of persons. So we are able to pull out, for Belize in particular, what are the specific factors that are related to them having the disease or them having the likelihood of developing the disease.
Yeah.
There are some scenarios that we know exist in our country already. And for example, we are saying that the project, the ICDF project, has essentially four core capacities. Building and reinforcing the knowledge and skills gained by our dialytic nurses or those who work at KHMH, Lumalus, resensitizing physicians to be able to identify patients that come into your center and suffer from these diseases, but also those that may present with other symptoms. So that's building capacity. There's the health promotion and prevention aspect of the project. There's an enhancement of the health information system, the BHIS, because through the BHIS we've been able to identify, for example, we have about, and this is not, these are figures that need to be corrected, about between 18 to 25,000 diabetic persons. A bit more that we need to correct because we have to have certain criteria.
And those are just the ones who come in contact with
Just
the BHIS
only the
system.
BHIS.
Yeah.
We have over 18,000 persons who suffer from high blood pressure. So essentially saying we have 50,000 Belizeans who have these two diseases on their own, and they can also have it combined.
Yeah.
So comorbid diseases, having diabetes and high blood pressure.
Wow.
So what we train training our physicians is to able to identify a person who may have high blood pressure, who is listless, not concentrating, feels tired constantly, has saggy eyes, swelling of the eyes, he may have paleness in the eyes, he may have shortness of breath, he may be within the ages of 20 to 55 and may be going frequently to use the bathroom, to urinate. When he does this, there's an increase of the urine is foamy or smells bad, that he has swollen legs, that is progressive. And so these are some of the signs that he doesn't have enough fluid intake. These are some of the signs that can be identified within the health facility. And so these are persons that we have identified readily through the BHIS. And we have a certain number that we need to review and have these persons come in and get checked on a regular basis to ensure that they are truly persons who may have what you call a pre-renal disease or a renal impairment status, and so they are like stage 1. And to prevent them from going further, then we need to build capacity to educate our physicians to be able to say, you know what, you need to cut off the salt, control your diabetes, exercise, increase fluid intake. And so these are something that can prevent or prevent the disease from progressing further on a faster basis. We also have that, for example, in Central America, we have the idea of what she mentioned. We have Belizeans going to taking herbal medicine or taking certain supplements. People who we live
without medical advice.
Without medical advice, we live in a country that is very hot, so we don't hydrate ourselves. In Central America, you have the epidemic of what you call non-traditional kidney disease, in which they use a lot of pesticides to without protection within the fields. So this is actually damaging the kidneys. We don't know if that is also part of our experience in Belize, but it's part of the
Yeah.
project. So
Well,
this is a risk factor as well.
You read my mind with one of the questions I wanted to get at, because what I didn't hear outlined, and I know it's not the full extent of the questions, but two things: the environmental factors and how those will be included within the surveys, and secondly, the different demographics, especially based on whether it's rural or urban locations,
Yes.
and cultural identities.
Oh,
Because
yes.
what I may eat from a Mayan community
Yeah.
versus a mestizo community will be different.
Yes.
So will these also be factors that will be looked at?
Yes, we have definitely made allowance in the questionnaires for that. We'll be asking about persons' ethnic group, their age, sex is important as well. We'll be asking about country of, so that could be a factor
Yeah.
as well. Like I mentioned, we'll be asking whether they're exposed to chemicals and how frequently they're exposed to chemicals. So all of this, we'll be able to disaggregate the data by district and by urban rural, and we are also hoping to be able to disaggregate by communities based on the size of the community, because one of the aim of this project is to be able to target the interventions by the Ministry of Health based on where these persons are located.
Is it a randomly selected sample size?
It is. We are selecting 10,000 households. It's representative across the country.
Okay.
The SIB, we don't usually do such a large survey. I think this is the first time that we're doing such a large survey. The mix was only 6,000 households, and that was the largest one.
Okay.
So this is really significant for us in terms of the scope of the survey. We'll have 7 teams out in the field, 2 teams in Belize district, and 1 team in each of the other districts.
Okay.
And our people will be out there. They will be easily identified. They'll be in a marked vehicle with the SIB logo right there.
Yes.
They'll have on their uniform. They'll have an SIB ID. Both the nurse and phlebotomist and the interviewers will have their SIB ID, and we encourage persons that if they're doubtful about where these persons are coming from, feel free. Our number is on the ID card. So just call us to verify, that they're legit. And we'll be starting work on Monday. We just finished 8 days of training yesterday.
Okay.
And we have also been working with the nurse and phlebotomist to make sure that they are on board with this. In most areas, we'll be out in the field until about the 3rd week of October.
Oh, wow.
But for Cayo, we'll be in the field until hopefully the end of November.
Okay.
Yeah.
We're hoping to finish before that, but a large survey will be collecting from places that we haven't gone in many years.
And it's quite a lot of different type of data you'll be collecting as
Yes.
well. Now, in your training, obviously, you'll be talking to the personnel who will be going out, the surveyors, about potential barriers. And one of them is that people can be a bit private about their healthcare information.
Yes.
Or some of it is completely unknown. I don't know what my grandmother died from. We
Right.
just say natural causes.
Yes.
Or I don't want to tell you that I have a fried chicken every day for dinner. How do you overcome those potential barriers when you go out so that you can have the best or the truest information once you have collected your data?
One of the most important things we train our staff to do is to emphasize that under the Statistical Institute of Belize Act, we are not allowed to share anybody's personal information with anyone. When we give a data set, it's because all the names have been taken out. There's no way to identify anyone. All the information, when it's released, it will be aggregated so you can know what's happening in Independence, for example, but you'll never know what is happening at John Brown's house.
Yeah.
And they are trained to speak about this.
Yeah.
Also, They are trained to be able to explain the purpose of the survey, the purpose of each of the questions that they'll be asking, and the nurse will explain to the respondent what are the risks involved in the entire process, what are the benefits. They will be asked to sign a form to say that they understand this, in effect giving informed consent. And if they don't sign this form, then we won't go through with the screening process.
Okay.
However, we want them to participate, so we want to encourage them that, like Dr. Morey mentioned, you could have chronic kidney disease, you could be leading up to it and you don't know. So this is important. One of the benefits is that the test that we'll be doing, they will be able to go to the hospital and get the results.
Oh, okay.
Just as
And what about the fear of needles? Somebody may be able to tell you everything, but won't want to give. And this is real. We know
It
people
is.
who
It
don't
is.
get HIV tests because of
Yes.
needles and don't go to the hospital at all
Because of
they're
needles.
so fearful.
just before, I think Jacqueline can answer. They have SIB has a wealth of experience in doing this.
Yeah.
But I just wanted to mention one thing. Last week we had about 56 persons participating in the training, and one of the questions was from John is how many of you have a person who's diabetic in your family, or suffers from high blood pressure, and we approximately had at least between 32 to 36 persons within that workshop raising their hands,
Wow.
which is significant. So therefore, with this anecdote, I respectfully ask the general public to help us, because it has the purpose of this survey is enormous, and it will give us a feedback that we could use for policies to help improve our services delivery at the hospitals and nationally. So it's the value is not only are we not only have we been tasked by something that is as huge as it's the first within the region, and it's an experience for the country to say, look, we've done the survey, we have this rich knowledge on how we can implement different strategies to control and provide better services.
Very interesting, though, especially with rolling out this survey and what will eventually be the end product of it. Now, the reason why I say this is because the lifestyle of yesteryear is totally different from lifestyle of today's day and age, and I'm looking at what you can do. Drink more water. A lot of folks now are drinking actually energy drinks to try and keep up.
And soda.
Limit sugar and salt intake. Energy drinks are filled with sugar. Exercise regularly. Now we tend to want to hang out rather than to exercise. Back then it was because of especially the lighting and whatnot. It used to be totally different. Quit smoking and alcohol drinking. That's actually a lifestyle for a lot of people in today's day and age. Get full checkup twice a year. Now, while the survey is will be rolling out this coming Monday, because we know now signs, we might feel some of the signs. Am I able to go somewhere rather than to, the folks are coming in. We know that here in the Belize district, we know that there'll be 2 teams, but we don't have to wait for the 2 teams, do we? Where do we go?
We don't have to, in general, you don't need for us to have a survey for you to take care of your health.
Yeah.
If you you have people who take a checkup on a yearly basis, and that's your practice, then you go ahead. If you have any symptoms, or for example you're feeling headaches, or you're feeling dizzy, or you have any other symptoms, then you can have access to your physicians. In the general public, we have all the facilities within the Belize district that you can have access to. We have Cleopatra White, Matron Roberts, the KHMH, of course, with all its different protocols that are have been set already. And in the districts, we have all the hospitals, so there is access to healthcare.
Okay.
So if you have any symptoms suggestive of this, that you might be suffering from kidney disease or any other disease, it's your own personal responsibility to take care of yourself.
Yeah.
So if you want to go once a year, that is fine. If you can go twice a year, you have the monies, because if you want to go to the private sector, which you don't have to wait the long waiting hours of 1 or 2 hours like in our public hospital, which is a reality, then you have that access.
Okay, but you know, one of the things that strike out, and I'll play the role right now of somebody who is actually watching. You mentioned, though, Jacqueline, that the sex of the individual is very important. Now, why is this important? And I sit down and I think about it. Okay, I'm male, so why is this important?
There are certain diseases that men are more likely to get than women. Men tend to practice different lifestyles than women. For example, we did, as part of the training, we did a field practice on Monday, and we were looking at some of the data. And one of the things we were seeing in the data, because we asked about whether you have ever smoked and if you currently smoke and how many you smoke per day. We ask about whether you drink alcohol and how much you drink. And it's very clear already in the small amount of data that we collected on Monday that men drink much more than women, and men smoke much more than women. So notice that one of the what you can do here is quit smoking and alcohol drinking.
Yeah.
Because of these differences in lifestyle, in health behaviors, men are less likely than women to seek health care.
Or to come in contact. Yeah.
Yes, and so we need to know what we need to focus on when we're speaking with men and what we need to focus on when we're speaking with women.
Yeah. And while we have some data, not a lot, but we do know that alcohol consumption in the country is excessive, and especially when it comes to men. And we also should know that it does have an adverse effect on the health of your kidney as well.
Yes.
Now, I think it's important, and John was getting at some of the things we can do to reduce our risks for kidney disease. And there's so many things. When I think of kidney disease, it's a very sad situation because there are many things that are part of our daily life that can contribute to the development of kidney disease, like our lifestyle, not drinking enough water in such a hot country, not exercising enough, or excessive intake of sugar and salt and carbohydrates. We also have diabetes and hypertension as fairly prevalent conditions. And coupled with that, the potential for treatment for later stage or end stage kidney disease is dialysis. And I think as much as we try to drive this point home, nobody wants to get to that point because we cannot do, if you can afford a kidney transplant outside of the country, the medication and even the likelihood of it working is a whole, that's a risk in itself. So we are doing so much that can cause this disease, and if we develop the disease and reach the end stage, it is a very difficult scenario, financially or even with your future prognosis. So the education aspect is so important. Is that also built into the survey? And how do you do that without being too preachy? If I just finish telling you, listen, I have 3 drinks every day, and I never exercise, how do you move to that part where you also educate so people can understand that this isn't something we should take lightly?
Well, the education is not included in the survey.
Okay.
The only education that will happen is that we leave the flyers with them.
Okay.
Our interviewers are trained to not raise your eyebrow if someone tell you that they had 20 cigarettes on a daily basis.
Okay.
So we try not to be judgmental at all.
Okay.
That will come after the results are available.
Yes.
Yeah.
For example, in most of the training for the nurse, for the biochemists and the interviewers, we always emphasize, because chronic kidney disease, there's no syndrome in early stage. So it means if you're not aware of this, you don't will have any healthy behavior.
Yeah.
So we always emphasize, do you have any family or friends you have a chronic kidney disease? Who have them? And they will think about, maybe my friend or my family, they have this kind of disease. So we just emphasize, if you think about, you care about your health and your family have this kind of situation, you should notice your health. So after the survey, we will provide flyer. That's why the nurse, they will just let you know, okay, after you will release a survey, you know what's our purpose, and we encourage you do the regular checkup, and you can review what's your health style, and you can try to promote your health style. Yes.
And from the Ministry of Health standpoint, we know that obviously subsidizing dialysis treatment, and you have people on a waiting list to be able to get on dialysis treatment, this is definitely becoming a public health concern as well.
Yeah, certainly the dialysis scenario or the chronic renal failure scenario in Belize has become an epidemic and a burden to our society. Now, the ministry may never have enough money to be able to provide all the services that are needed. But prevention is the key to having the numbers decrease. And so part of the project is also doing these flyers, trying to educate the community in regards to what is kidney disease, how to avoid it, and how to prevent it as time goes by.
Yeah. Okay, so let's leave people with that information. What do we need to be doing within our daily lives to ensure that we can maintain optimum kidney health?
Yeah, so as we said, rightfully said, as if you already have a condition, for example, diabetes, you need to ensure that your blood sugars is controlled within acceptable limits, and that your blood pressure is controlled, that you take your medications on a regular basis, that you exercise, that you avoid energy drinks, for example, that are rich in sugar or high carbohydrate content, avoid salty food, get your regular checkup for kidney disease on a regular basis, at least twice a year. You hydrate yourself. You avoid alcohol and other situations that are toxic to your body. For example, smoking and stuff like that. So these are some of the basic things that you can do to change your life to avoid some of these diseases.
You know, one of the things that strikes me a few days ago, yesterday actually, the day before, I was coming from a particular spot with my daughter, and we were having a conversation, and now she will be going to UB. So while the conversation struck me when she mentioned that, man, Daddy, I have to start to drink a lot of energy drinks because I have to study. And I will be staying up for a while studying. Now this shocks me, especially with limit sugar and salt intake, when the main content of these ingredient of these things are actually sugar or salt. So how do we get with this, knowing that, especially when it comes to testing from 20 to 55, now UB 16 to about 19, 20, 21, 25, how do we deal with this?
Well, I think we begin from a home scenario. And we would say that certain diseases, diabetes, obesity, and things of what you eat makes you become a certain person in life. And by that I mean, for example, we have children born to mothers who are like 10 pounds, 11 pounds, 12 pounds. These are macrofetals. But the mother is also obese or maybe diabetic. So if you're saying that certain disease, for example, obesity begins from that scenario, or cholesterol issues begin from the womb, then when the baby is born, and he's growing within his early childhood, if you give them sodas, then they take it on into their formation within their pre-adolescent stage and adolescence, and then into the adulthood. So we have to educate at an early stage. What is nutritious, what is healthy, how to avoid these high sugar content drinks. And there's even, for example, a trend presently within the South and Central South America is that, for example, the labeling of these products in the store, if it tells you not it has 100% sugar or 30% sugar tablespoons of sugar, you as a parent need to tell, look, this is bad for you. You need to avoid it. So we have to start from home, teaching our children how to avoid and not consume these high energy drinks and which are rich in carbohydrate and salt.
Now, the results of the survey obviously will give you a lot of information in terms of what people are consuming before we make any assumptions. And you know, we know that there are many energy drinks on the market, there are many juices and sodas. I want to say, I have the statistician in front of me, but safely assume that children and adults are drinking a lot of sugary drinks. Now, is there anything in terms of what will come out of this research that can help to fuel policy in terms of labeling, in terms of even locally produced beverages as to how much sugar should or could be allowed in the product that they're making?
There's a current PAHO and WHO projects going on in various countries in regards to influencing how data can influence policy, and then how this translates into changing lifestyle and behavior. There are issues in regards to, for example, the labeling, as you rightfully mentioned, how the evidence base that we are gathering here needs to change policy at the cabinet level. Of course, for this, then it says, okay, we found out that the consumption of 100 cc of Coke on a regular basis is creating a diabetic scenario in the mild population, for example. And so our minister would have to say, look, we need to cut down on or increase taxes on the acquisition of you being able to purchase soft drinks or drinks that are high in carbohydrates in the stores. So these are things that we want to see eventually. It may not happen today, but there is time for that.
And there are countries that are doing that who have had success.
For example, even in Mexico, and there are certain areas that policies that limits, around a school you have 2 or 3 blocks that you cannot advertise any type of drinks that are high in carbohydrates. And so these are policies that are already in place. Some countries are adopting it. We may get there eventually.
Okay, so starting Monday, you may have a knock on your door. And this isn't, people need to know that you're not going to every household, but you may be selected as the household that will be surveyed. Let's just go through once again, Jacqueline, in being as safe as possible, what people should look for, and what they should expect.
All right. So you will see a team traveling in a marked vehicle. It will be a van. It will have the Statistical Institute of Belize's logo on the van. All the interviewers, that's the logo right there, will be wearing white t-shirts like this one with the SIB logo on the front and the name of the institute clearly written on the back of the shirt.
Okay.
Each person will be carrying a Statistical Institute of Belize ID. We encourage persons that if you're not sure, if the person forget to show you the ID, ask for the ID. SIB workers will have the ID. The nurses will have the ID. The nurses and phlebotomists will be wearing either their uniform or their scrubs or a t-shirt that has the SIB logo as well as the Ministry of Health's logo on it. Our interviewers are trained to introduce themselves, say what the survey is about, and to be confidential about how they maintain people's data. It will be safe to give us your data. We will not let anyone see your individual information. Like I mentioned before, your results will go into the health system, so you can go to the hospital, take the informed consent paper that you sign along with your ID and get your results and take it from there. Please, we're asking for your cooperation. This is for the benefit of Belize's development. If we don't know what is happening, the policymakers can't fix it. So please give us the data.
All right. Thank you so much for coming in. Best of luck. It's quite a lot of work that's ahead of you.
Definitely.
But we look forward to the results after you're done with your work. And a timeline for when you'll have your first report out following the collection of the data? Do we know as yet?
We expect to pass a data set to the ministry by the end of January.
Okay.
Yes.
All right. Well, thank you and best of luck.
Thank you.
Thank you so much.
We're going to go ahead and take a break. When we come back, we'll be joined by Mayor Darrell Bradley. Stay